Let me tell you something that keeps me up at night. In my practice, I have seen this pattern repeat over and over and over. A patient over 60 has a heart attack at home, alone, and they don't make it. Not because the heart attack was unstoppable, but because they didn't know what to do in those first 5 minutes. They waited. They second-guessed themselves. They told themselves, maybe it's just indigestion. And by the time help arrived, it was too late. If you're sitting across from me right now, this is what I'd tell you. What I'm about to share could save your life. Not someday, today. These aren't complicated medical procedures. These are simple actions. Actions you can do right now, in your own home, even if you're completely alone. And you need to stay with me through all 7 of them, because number 3, it's the one most people have never heard of, and it can double your odds of walking out of the hospital alive. Hello? I'm Dr. Mia Caldwell. I'm a geriatric medicine doctor here in New York. If this video helps you even a little, please tap the like button and share it with someone you care about, someone you want to protect. Now, let's move on to tip number 7. Tip number 7, call emergency services immediately. Number 7, call emergency services immediately. Don't wait it out. I'm going to say this clearly because I don't want you making this mistake. The patients who survive heart attacks, they call for help in the first 5 to 10 minutes. The ones who don't, they wait. They tell themselves it's probably nothing. Probably just heartburn, probably just stress. And I understand why, I really do. You don't want to bother anyone. You don't want to feel embarrassed if it turns out to be nothing. But here's what I see in my practice. Almost every week, someone waits 2 hours, 3 hours, hoping it'll pass. And by the time their family finds them and calls 911, the damage is done, sometimes irreversible. There's a phrase we use in cardiology, time is muscle. Every minute you wait, more heart cells die. It's that simple and that serious. The American Heart Association found something important. Patients who call for help within the first 5 minutes, their survival rate is 50% higher than those who delay. 50%. I remember a gentleman, 68 years old. He was home alone one evening, felt this strange pressure in his chest. He told himself, it's probably just gas. Drank some water, sat down to rest, he waited 4 hours. By the time his daughter found him and called 911, the doctors told her if he'd called right away, he'd probably be fine right now. I'm telling you this not to scare you, but to prepare you. If you're over 60 and you ever feel crushing pressure in your chest, sudden shortness of breath, unexplained nausea, or cold sweat for no reason, pick up the phone, call emergency services, act as if it is a heart attack until someone tells you it's not. Even if it turns out to be indigestion, you've lost nothing. But if it is a heart attack, you've just taken the most important step to save your own life. So that's step 1, make the call. But while you're waiting for the ambulance, what you do next can buy you even more time. That's tip number 6. Tip number 6, chew an aspirin. Number 6, chew an aspirin if you have one available and you're not allergic. Not swallow, chew. And let me explain why this matters. A heart attack happens when a blood clot blocks the flow to your heart muscle. Aspirin is a clot fighter. It thins your blood. It stops that clot from getting bigger. And it keeps at least some blood flowing until help arrives. Now here's the science part, but I'll keep it simple. A major study published in The Lancet found something powerful. Taking aspirin during a heart attack reduced the risk of death by 23%. 23%. But here's the catch. Speed matters. If you swallow aspirin whole, it takes 10 to 12 minutes to break down in your stomach. If you chew it, it starts working in minutes. The active ingredient absorbs through your mouth and stomach lining immediately. And in a heart attack, those minutes can save heart muscle. They can save your life. I had a patient, retired bus driver, 70 years old. He was home alone watching TV when he felt that crushing pressure. He remembered what I'd told him in our last visit. He got up, grabbed the aspirin bottle, chewed one tablet, and called 911. The paramedics told him later, that aspirin kept your blood flowing just enough. You're lucky you knew to do that. Now here's where I need to slow you down. If you're allergic to aspirin, if you have a bleeding disorder, Or if your doctor has specifically told you not to take aspirin, skip this step. For everyone else, I advise my patients to keep a bottle of regular, uncoated aspirin somewhere easy to reach, not in a locked cabinet, not upstairs in the bathroom, kitchen counter, bedside table, somewhere you can grab it fast. The dose is simple: one 325 milligram tablet. Chew it. Think of it like this. That aspirin is like sending in a small rescue team to slow down the disaster, while the big rescue team, the paramedics, are on their way. So that's number 6, chew aspirin. But surviving isn't just about what you take, it's also about how you position your body, and that's tip number 5. Tip number 5, loosen clothing and sit upright. Number 5, loosen tight clothing and sit upright. This one surprises people, but it matters more than you'd think. When a heart attack happens, your heart is struggling. It's trying to pump blood through blocked or narrowed arteries, and anything that makes that job harder, that's a problem. Tight belts, tight waistbands, buttoned collars, even a tight bra, all of these compress your blood vessels. They make it harder for oxygen-rich blood to circulate. So the first thing I advise my patients to do, loosen everything. Belt, waistband, collar, anything that's restricting you. Now the second part, sit upright, not lying flat. Not slouched over, upright, back supported, maybe leaning slightly forward if that feels better. Here's why. When you sit upright, it takes pressure off your diaphragm and lungs. Your lungs can expand more easily, more air gets in, more oxygen reaches your blood. Lying flat, that makes your heart work harder, especially if you have lung issues like COPD or if you're already short of breath. In my clinic, I see this almost every week. Patients tell me they laid down when the chest pain started because they thought rest would help, and I have to gently explain. Lying flat during a heart attack actually makes things worse. There's research from the European Heart Journal that shows positioning patients upright during heart distress reduces fluid buildup in the lungs. Basically, it keeps you from drowning in your own fluids while you're waiting for help. I remember a 74-year-old woman. She was gardening when she felt the chest pressure start. Instead of lying down in panic, she walked to a chair, loosened her gardening apron, sat upright, and waited. Her doctor told her later, that decision probably kept you from fainting before the ambulance got there. So if you ever feel those symptoms, sit up. Relax your shoulders, free your chest and waist, give your heart room to breathe. That's number 5. But now we're getting to something most people have never heard of, and it's powerful. Tip number 4. Tip number 4, cough strongly if you feel faint. Number 4, cough strongly if you feel faint. I know, this sounds strange, but stay with me, because this technique has saved lives. Doctors call it cough CPR, and here's how it works. When you cough deeply and forcefully, your chest muscles contract. Your diaphragm compresses. Pressure builds up inside your chest, and that pressure, it forces blood out of your heart and into your brain. It keeps you conscious when your circulation is collapsing. Now, let me be very clear. This is not a replacement for calling 911. It's not a cure. But if you feel yourself getting dizzy, if your vision starts narrowing, if you feel like you're about to pass out, coughing can buy you precious seconds until help arrives. There's research in the Journal of the American College of Cardiology that showed repeated strong coughing kept patients conscious during dangerous heart rhythms. In some cases, people stayed alert for several minutes just by coughing every 2 to 3 seconds. I read about a 69-year-old retired mechanic in Texas. He was alone in his workshop when he felt sudden dizziness during what turned out to be a massive heart attack. He remembered hearing about cough CPR somewhere, so he started coughing, hard, every few seconds, and he stayed conscious until the paramedics arrived. The doctors told him later those coughs likely prevented brain damage. Here's the simple version. Fainting during a heart attack happens because blood flow to your brain drops suddenly. Coughing hard creates artificial heartbeats, like manually squeezing a pump with your chest muscles. It's not perfect. It won't stop the attack, but it can keep oxygen flowing to your brain long enough for help to take over. So if you ever feel your vision narrowing, your head spinning, your body going limp during chest pain, take a deep breath, then cough, hard and strong, like you're trying to clear your lungs. Repeat every 2 to 3 seconds. That's it. Simple, but powerful. That's tip number 4. Now, once you've stabilized yourself, there's something else you need to do to make sure help can actually reach you, and that's number 3. But before we get there, if you're finding this helpful, go ahead and hit that like button. And subscribe so you don't miss future videos like this. All right, let's keep going. Tip number 3, unlock your door and keep phone nearby. Number 3, unlock your door and keep your phone nearby. This sounds so simple, almost too simple. But I've seen cases where this one step made all the difference. Here's the problem. Paramedics can break down a door if they have to, but it takes time. And during a heart attack, time is muscle. For every 10 minutes of delay, survival rates drop by nearly 10%. Imagine losing those life-saving minutes just because help couldn't get inside. I heard about a 73-year-old widower in Arizona. He called 911 after feeling severe chest pain, but he collapsed on the floor before he could unlock his front door. Paramedics arrived within minutes, but they had to force their way in. By the time they reached him, too much damage had been done. Contrast that with an 80-year-old woman in Florida. She felt the symptoms start. She unlocked her door, she grabbed her phone, and she sat in a chair right by the entryway. Paramedics got in immediately, started treatment, rushed her to the hospital. She survived with only minor heart damage. So here's what I advise my patients. If you have called 911, first thing, unlock your front door. Do it immediately, and keep your phone with you. Always. Many seniors make this mistake. They leave their phone in another room. During a heart attack, even walking a few steps can make you collapse. So keep your phone in your pocket, on a lanyard, or clipped to your belt. Your phone is your lifeline. An unlocked door helps emergency workers reach you faster. That is number 3. Now, the next step is about keeping your body calm enough to survive until help arrives, and that is tip number 2. Tip number 2, take slow, deep breaths. Number 2, take slow, deep breaths. In the middle of a heart attack, panic is your worst enemy. When fear takes over, your body goes into fight or flight mode. It floods your system with adrenaline, your heart rate spikes, your blood pressure shoots up, and your already struggling heart has to work even harder. That's why one of the simplest things you can do is also one of the most powerful. Breathe slowly, deeply. Deep breathing does 2 things. First, it gets more oxygen into your blood and brain, which are desperate for it when circulation is limited. Second, it signals your nervous system to calm down. It lowers that surge of stress hormones. Research in the Journal of Cardiopulmonary Rehabilitation found that slow, controlled breathing reduced heart rate and improved oxygen delivery, even in patients with serious heart disease. It's not a cure, but it gives your body a fighting chance while you wait. I had a patient, a 76-year-old retired nurse. She told me how she survived her heart attack by focusing only on her breathing. As the pressure in her chest grew, she didn't panic. She sat upright, closed her eyes, and breathed in through her nose, out through her mouth, slow and steady. By the time paramedics arrived, she was weak, but she was conscious. Her cardiologist told her later, "Those steady breaths probably kept oxygen moving to your brain long enough for us to help you." So here's how to do it. Place one hand on your stomach, not your chest, your stomach. Inhale deeply through your nose. Feel your belly rise, then exhale gently through pursed lips, like you're blowing through a straw. Aim for about 6 to 8 breaths per minute. Slow, controlled, deliberate. Think of each breath as buying yourself more time. Time for oxygen to reach your brain, time for your heart to ease its workload, time for help to arrive. This kind of breathing not only helps your heart, it keeps your mind focused when panic wants to take over. One of the most common mistakes I see in people over 60 is this. They feel chest pain and immediately start hyperventilating. They breathe fast and shallow, and that only makes everything worse. So remember, slow, deep, steady, that's number 2. And now we're at the final tip, the most important one, the one that research shows can double your odds of survival. Tip number 1, stay calm and still. Number 1, stay as calm and still as possible. This is the most important survival rule. When a heart attack strikes, your first instinct might be to move, to pace, to try and walk it off. That instinct can be deadly. Every step you take forces your weakened heart to pump harder. And during a heart attack, your heart is already fighting for its life. By staying still and calm, you reduce the strain, you conserve oxygen, and you give yourself the best chance of surviving until help arrives. The science is clear. During a heart attack, blood flow through your coronary arteries is blocked or severely reduced. Movement demands more oxygen from your heart muscle. But with the supply cut off, that extra demand only increases the damage. A study in the European Heart Journal found that minimizing exertion during acute heart episodes reduced complications and improved outcomes. In other words, seniors who stayed calm and still lived longer than those who moved around in panic. One of my colleagues told me about a 71-year-old farmer in Nebraska. He was repairing equipment when he felt crushing pressure in his chest. His first thought? Climb back up the ladder to grab his phone, but he stopped himself. He forced himself to stay put, called for help from where he was. Paramedics told him later, "Staying still kept your heart from collapsing under stress. You made the right call." Now, calmness isn't just physical, it's mental. Panicking floods your body with adrenaline, it raises your blood pressure, it worsens the attack. So here's what I tell my patients. Focus on staying still. Practice those slow, deep breaths we just talked about. Tell yourself, I've called for help. My only job now is to stay still and breathe. This mindset prevents rash decisions, like trying to walk to the door or trying to grab something across the room, actions that can trigger collapse before help arrives. I often have to stop my patients and explain this clearly. Your body after 60 doesn't respond the same way it did at 40. This is the final, most powerful habit. Do less, breathe more, and let help reach you. Recap and call to action. And there you have it. 7 life-saving tips every senior must know to survive a heart attack alone. Let me recap quickly because these could save your life. Number 7, call emergency services immediately. Don't wait, don't second guess. Number 6, chew an aspirin if you have one and you're not allergic. Not swallow, chew. Number 5, loosen tight clothing and sit upright. Give your heart room to work. Number 4, cough strongly if you feel faint. It can keep you conscious. Number 3, unlock your door and keep your phone nearby. Make it easy for help to reach you. Number 2, take slow, deep breaths. Control the panic, control your survival. And number 1, stay as calm and still as possible. Movement makes it worse. Each of these actions buys you precious minutes. And those minutes, they can mean the difference between life and death. The patients who do well usually have one thing in common. They acted fast, they stayed calm, and they knew exactly what to do. Now you know too. Now before we finish, I need to share an important medical disclaimer. This video is for educational purposes only. I'm sharing general health information based on my experience and current medical evidence. But I have not examined you personally. I don't know your specific health history or conditions. So please do not take this as personal medical advice. Always talk to your own doctor or healthcare provider for recommendations based on your specific health needs. They know you, they know your medical history, and they can give you personalized guidance that's right for you. This information is meant to prepare you and inform you, but your doctor is your partner in your health decisions. Now, I want to hear from you. Where are you watching from? And do you keep a aspirin or an emergency plan ready in your home? Drop your answer in the comments below. I read and reply to every single comment because your story matters, and your survival tips could help someone else. Don't forget to like this video. Share it with your loved ones, especially anyone over 60 who lives alone. And subscribe for more life-saving advice. If you were sitting across from me right now, this is what I'd tell you. Being prepared isn't about being scared, it's about being smart. Knowledge is power, especially after 60. Stay safe, stay prepared. And remember, you deserve to feel confident about your health. If you have any questions or want to share your personal experience, don't hesitate to leave a comment below. We're always listening. Thanks for watching.